We don't go into a marriage thinking we're going to be living without our spouse. So of course it's sad, but it is what it is. And so it's all about, so what's important is knowing that not only can you manage it, but that they're going to manage it. You know, when I was diagnosed, it was like there's part of the brain tumor, and so my fear was lack of communication at some point along the road. So it opened up a million channels that I needed to deal with and be proactive with right off the bat. So we talked about do not resuscitates, we talked about funerals, we talked about dying, we talked about hospice, not dying at home, palliative care, the whole thing. And this is with Mike and the kids. They were all there. And so the resources, North York General has provided wonderful resources in terms of the palliative care department, Dr. Horvath and Kata. And sometimes it's just sitting down and talking to them about your worries, your fears, your concerns, and where you want to go. You know, everyone's diagnosis is so different. And the way they handle it is so different. And the first little part of it, you just feel so completely out of control, I think. Or I think a lot of people feel just completely out of control. And they're waiting for tests, and it's just a really miserable time. And I think whatever you can do at that stage to sort of pull back some control, whether it's going out and getting a book that helps you cook in a cancer-free way, or taking some yoga, or taking some meditation classes, or going to Wellspring to see what's available, or calling Willow is the other one that's so great at North York General now, that gives you resources, people and places to reach out to help you with your journey, because it's pretty tough to do it alone. How will you die and where will you die? I mean, there are choices there. You can die at home. You can bring in a hospital bed. You can bring in the oxygen tanks. You can get some assisted nursing help. And I really thought a lot about it. I watched a friend of mine try to die at home, and it was very, very hard on her family, a lot of stress. And my belief, and of course this is projecting that it's going to be horrible, my belief is that the home's sort of a sanctuary for everybody, and if they associate a room in your house or your house as suddenly this place that's fraught with the end of a life, does that undermine their sense of peace and calm in their house? So I thought, yeah, I think so. So maybe what I want to do is be in a hospice. We're all going to die, and if we're very, very lucky, we're going to have friends and family around us and no discomfort. Like, that is absolutely the best case. So we have to try not to be afraid of death, and take advantage of the palliative options that are available to us. I mean, you think of all the stuff that's going on all over the world, and the heartbreak and suffering that children and people go through, and realize how really lucky we are here to have this kind of health care. The doctors really are guesstimating. They probably don't know. Probably don't know how the tumors are going to behave. They know that the tumors that are in the brain are the problematic ones. And, you know, I tried to get one of our doctors to pinpoint where they are, simply, and how that it affects the function, because you can't help but want to know, when I fall off this cliff, cognitively, what is it going to look like? Is it going to affect my speech, my cognitive functioning? Or am I going to become like this crazy lady who's screaming obscenities at their family, completely changing the personality of who I am or who I want to be? And that part is the part that's difficult. But we had an appointment, and all the kids were there with a palliative care doctor, and who's a wonderful person at North York General. And so we expressed these kinds of concerns to her. And she gave us a great sense of peace, which is where the palliative piece comes in, because there is so much that's unknown about this stuff. And all you really want to know is that you're not going to suffer and your family's not going to suffer. So she said, we can deal with physiological pain, we can deal with emotional pain, and we can deal with existential pain. So in other words, we've got you covered. Your family know who you are. If your behavior becomes such that they know you'd be unhappy with that, she'll be able to deal with it. So part of it is the time frame, but it's, you know what, it sounds sort of like a hackneyed phrase, but it's really more about the quality of life, that you want to hang around, but not at the expense of the quality of your life.